Well, thank you, Madam Chair. Thank you to the families and the witnesses for giving us their time and their expertise today. Also, just want to thank Chairman Pallone and Chairwoman Eshoo for holding this important hearing. This hearing is so timely as the COVID-19 pandemic has exacerbated workforce issues that were already present pre-pandemic across the healthcare continuum. I'm pleased this committee recognizes that and is highlighting legislation that aims to address these issues, including my bipartisan bill, the Bolstering Infectious Outbreaks Preparedness Workforce Act, or the BIO Preparedness Workforce Act, which I introduced with Congressman McKinley. Madam Chair, I would love to offer a stakeholder letter of support for the BIO Preparedness Workforce Act for the record.
Ordered.
Thank you. As many of my colleagues have expressed today, COVID-19 has highlighted long-standing health disparities in the U.S. In addition to COVID-19, other infectious diseases like HIV also disproportionately impact people of color. And people of color face greater barriers in access to health care. At the same time, Black, Latinx, Indigenous, and other communities of color are underrepresented in medical professions. The Biopreparedness Workforce Act authorizes HHS to consider geographic equity and ensure that contracts help to increase the number of underrepresented minority individuals serving as biopreparedness health professionals or infectious disease health professionals. I'm concerned about the disproportionate impact of COVID-19 and other infectious diseases on underserved populations, including our communities of color. And it's important to increase access to culturally competent healthcare, particularly during a pandemic or another public health emergency. Dr. Marazzo, you mentioned to my colleague, Congresswoman Blunt Rochester, how you believe the Biopreparedness Workforce Act would help diversify the biopreparedness and infectious disease workforce. But could you elaborate on why a more diverse infectious disease workforce is important to advancing health equity?
Yeah, thank you so much for that question, Ms. Trahan. And I'm really grateful that the bill that you're sponsoring specifically gives the Secretary of HHS discretion to award loan repayment contracts in a way that increases the diversity of our workforce. As I mentioned before, financial challenges probably pose an even greater barrier for individuals from underserved communities to pursue careers in infectious diseases and in biopreparedness. A more diverse workforce really addresses a need for a culturally competent workforce. We know, as I mentioned before, that we do better, we resonate stronger with providers and people who look like us and who understand our specific health challenges. So getting a more equitable distribution of ID professionals, not just geographically, but also across these different strata of society, is really going to be critical to reach the patients that we need to reach.
Thank you for that. And in addition to physicians, many other health professionals are critical to biopreparedness and infectious disease care. I mean, many of these professionals, including our clinical lab professionals, our advanced practice nurses, and others are also struggling with workforce shortages and burnout. Dr. Marazzo, can you also elaborate on the types of biopreparedness and ID healthcare professionals, including their roles, their recruitment challenges, and how the Biopreparedness Workforce Act would help them?
Absolutely. I don't think anything has illustrated the need for a team approach more than this pandemic. We've all felt it very, very urgently. So in addition to physicians, you nearly need a team of healthcare professionals, and those include clinical laboratory professionals, infection preventionists, ID-trained pharmacists, advanced practice nurses, and physician's assistants. All of these folks are really critical to staff the sort of workforce that we need to deal with these things. And very importantly, all of these professionals are included in the Biopreparedness Workforce Act. These people are already in short supply. 25% of healthcare facilities have a vacancy for an infection preventionist position, with more than half of long-term care facilities, which have experienced incredible COVID challenges, as we know, having experienced loss of an infection preventionist in the last 24 months. These shortages are likely to grow more in the future as 40% of the infection preventionist workforce is expected to retire in the next 10 years. The other area is laboratory personnel. There's a very high total vacancy rate for clinical microbiologists, just over 10%. And also, that's a field that's aging. Probably about 17% of them are going to retire in the next 5 years. And then finally, pharmacists. We work very closely with ID pharmacists to make sure people are safely treated with many infectious disease agents. And they are very much in short supply. A 2018 survey of the acute care U.S. stewardship workforce found that pharmacist and physician FTE to bed staffing ratios, particularly in places in the country like ours, are well below recommended levels for stewardship to be optimal.
Thank you so much for that detailed response, and I yield back. Thank you.